Hello, welcome back to my practice. My name is Laurie Raffetto, MA, and as promised, this is the next in our series of YouTubes that asks an important question, kind of a shocking question. Is it possible to heal from PTSD? It's interesting that we even have to ask that question, and I'd like to explain what I think is the etiology of that question, where it comes from. I think it has to do with combat veterans who suffered from PTSD for decades, 20, 30, 40, 50 years, went to their graves often without relief of their symptoms. I think that has led some people to believe that you cannot heal from PTSD. I think that we started to only study PTSD in a serious fashion after the Vietnam War. So in World War II, we called it shell shock. It was sort of a fuzzy, kind of foggy sort of syndrome that everyone knew was there, but kind of didn't pay much clinical attention to. After Vietnam, it was researched. It was cordoned off as a syndrome unto itself. Symptoms were identified, and for diagnostic purposes, the idea of post-traumatic stress disorder began. So that's part of why we ask, can you heal from PTSD? I think the second part of the question that people are trying to ask when they ask that question is, can you change the past? Can I make it so that it feels as if that traumatic event never happened to me? And unfortunately, the answer to that question is no. Our past is our past, and those things that happen to us do make us what we are. So how we cope with the trauma is the essence of how you heal from PTSD. The falling down part, the injury part, was something you may not have been able to control. But the getting up part, the idea of healing, is something that is absolutely within your control. So I want to answer the question, is it possible to heal from PTSD? With an absolute yes, it's possible. It's possible to ameliorate your symptoms to where they make no difference in your life. You can't undo the event, but you can certainly take charge of what the event means and how you hope to express it in your life, how you hope to deal with it in your life. Examples of famous people who have had PTSD and done very well include Oprah Winfrey, Maya Angelou, Audrey Hepburn, and John McCain. All suffered serious traumas in their youth or in adulthood, and they have managed to live amazing, connected, productive, valuable, really kind of enviable lives. So they serve as evidence that it's possible to heal from PTSD. So how do you heal from PTSD? There's several evidence-based practices that work well. Cognitive behavioral therapy, where you identify thinking and feeling and behaviors. So how you think about something elicits a feeling in you, and it results in a behavior. Being able to identify those and then intervene somewhere in that cycle where you feel you have control is an excellent the source of relief for PTSD. Exposure and response prevention is another example of an evidence-based practice that has a long and storied history with PTSD. Basically, you're exposed in a controlled, safe, supportive environment with your therapist to those parts of the trauma that you most want to avoid. And slowly over time, as you are exposed incrementally to those particular stressors, the arousal symptoms dissipate and finally disappear completely. There is a new wave of treatments. One is mindfulness-based practices that would include ACT, which is acceptance and commitment therapy, which is a combination of CBT and mindfulness practices. And the beauty of mindfulness practices is they're the antithesis of PTSD. PTSD is just like that YouTube song, you got stuck in the moment and you can't get out of it. That is the essence of PTSD. Mindfulness-based practices are all about living today, in the here and now, feeling what you feel now, hearing what you hear now, living what you live now. And so it's really a wonderful treatment for PTSD, relatively new but showing great promise and widely practiced here in the Northwest. There's also medications you can take for PTSD. You will want to see your prescriber. So for some people, medications work well. For others, may not be the best answer. It's really a good idea to make sure your prescriber and therapist work in harmony on this particular issue. And finally, if you do find yourself in a very common position of having addictions, conditions comorbid or occurring at the same time as your PTSD, I cannot recommend strongly enough a group protocol called Seeking Safety. It was designed specifically for individuals with PTSD and co-occurring addiction issues. Best way to find a Seeking Safety group in your area is to just call your local community mental health center or your provider and ask if they know of any groups in the area. So there is our discussion about whether or not it's possible to heal from PTSD. You bet it is. And how with evidence-based practices, among other techniques. So till next time on my YouTube channel, this is Laurie Raffetto, and I'll see you again.